Welcome to the More Than Scrubs podcast, a podcast where dentists and healthcare professionals can learn how to thrive in or beyond their 9-to-5 job. I mean, don't get me wrong, I love my scrubs. But in this podcast, I want to explore how we can build a side hustle, a business, or excel in our careers so that we can have that work-life balance that everyone's always talking about. Healthcare careers have evolved so much in the past decade, so let's find a way that we can evolve with them. My name is Dr. Kamal Chopra. I'm a dentist, a business owner, and I want to take you on this journey with me to find out how we can be more than scrubs. So let's dive straight into it. Welcome everyone to another episode of the More Than Scrubs podcast. Today I've got Dr. Sarah here with me. Sarah, would you like to introduce yourself?
Yeah, hi. So my name's Sarah Carr. I am a community dentist and also skin expert with Tropic skincare.
Amazing. And how long have you done either roles for?
So I actually graduated back in 2010, and I had a bit of a path through different kind of aspects of dentistry. So I did GPT, so I did a few different hospital jobs and things. Ended up in MaxFax for 5 years as well. And then I just really loved like peds and special care dentistry. So community dental like really kind of fit the bill for me with that. So I've been there almost 10 years now, I think. Yeah, I did a little bit of a mix of the two at one stage, and then decided that I needed to pick something, and community was going to be the thing for me at that stage. So just been really enjoying that. Love the challenges and things that come with that. I love the difficult patient side of things, love all the anxiety management, that sort of thing. So really kind of found my way there.
Yeah.
But then realized I wanted a bit of something else as well.
Like most of us. Yeah.
So from there, I just wanted something a little bit more flexible, because I had two little ones, and really I love achieving new things, learning new things, and felt a little bit like I had sort of done a lot of training and things. I like sitting exams. I kind of done all the things. I did my special care diploma. I did my sedation diploma. I did extra training in intranasal sedation and things like that. And I just felt like I kind of done a lot of things. I like to do something a bit different. And I'd never really looked outside of dentistry for anything. I think we're very guilty of when you go into like a professional career, you're just primed from a really young age, aren't you, to put your head down, get your GCSEs, get your A-levels, get all your extracurriculars in a row, get the CV like tight so you can achieve the job.
Yes.
And then you're there, and then it's like, well, what do I do now?
Yeah, you're kind of not allowed to think about any other like fun options.
Yeah, isn't it? So I just, I thought one day I'm going to try and just do something a little bit else, almost as like a bit of a hobby.
Yeah.
Because I think I would always like the idea of having a hobby, but I like things to be functional and really purposeful.
Yes.
So I think some hobbies, to me, I just can't see the point in them. I love that.
Yeah, I totally feel you, because I'm like a person who likes to have hobbies, but I don't keep them, if that makes sense, because I feel like I need a purpose, like, you know, like drawing or painting. I love that in the past. But I don't do it because I feel like, what's the point?
Yeah,
which is really
that
bad.
painting.
Yeah.
So I was looking for something a bit more of a hobby.
Yeah.
And that's when I sort of fell into skincare. So for me, it started off as a hobby. It was about sharing sustainable, healthy skincare and makeup with people, and then it sort of snowballed into this business, and now I've got a team I look after and everything, so it's taken up a lot more of my time, and it's become a job as well.
That is so
which
cool.
has been amazing, which I love.
Let's just go into, when did you decide that you wanted something different? So this hobby with a purpose, when did you get to that stage of your career and you decided, let's do something a bit outside the box?
Yeah, I think it was more after I had my first child. We had quite a long, turbulent journey to get to that point, which I'll not go into all the details there, but I think you kind of, anyone becoming a mother, you do sort of lose yourself a little bit, and that's no bad thing in a way, because you are focusing on your family, which is amazing, and that's a huge gift. But I think you do focus on other people and not yourself. And if you do that for a long period of time, then you do have to sort of figure out who you are again and sort of reframe yourself, really, because you are a different person to what you were before, because you're a mother now. So I think I needed to just do something that was a little bit more for me, but just also felt purposeful. So sort of tying in something that was really a hobby but is also a job at the same time, that like really ticked the boxes for me, that I could feel like I could do something that was still about learning, still about being around people, and sort of tying in the sort of clinical side in a way with the skincare, while then being kind of a little bit away from family a little bit, just to do something for myself. It kind of tied all those things in, really. And it was when I was trying for my second, that's actually when I thought, right, okay, I almost need a little bit of a distraction, because getting pregnant again was going to be a challenge, and I needed something to focus on as well, so that I wasn't just putting everything into that, because that makes it not happen.
Of course.
So I thought one day I'm just going to put my big old pants on and just try something completely different. What's the worst that can happen? I think that's a good mantra to have, because with a lot of things, what is the worst that can happen? And I think we spend a lot of time, I think, as professionals, having decent brain in our heads, we do overthink things, and it's really easy to do that and not do things because we're concerned about all the risks. We can sit and just think of all the reasons why we shouldn't do something, but sometimes you've just got to trust your gut and go for it and be a little bit brave, haven't you?
Yeah, agreed. And I think it's also quite outside the box, starting a business or something that you haven't done before. Whereas with dentistry, like you said, you do your GCSEs, A-levels, you have a path set out for you already. So you don't really have to worry about the risk because it's kind of all laid out there. I guess the worst thing is that you might struggle to find a job, but as a dentist, it's quite easy anyway. But I was going to say, so do you think that becoming a mum changed your priorities, and then that's when you kind of wanted to do something different?
Yeah, I think it did, because you just realise that working in dentistry is not flexible. Well, I mean, you can have a small degree of flexibility on. You can perhaps choose sort of where you work, and but realistically, you kind of need like a 9 to 5 or 8 till 6 kind of daytime job, don't you? And fitting that around the school run, the sports days, the school shows they give you 2 weeks notice for, and you want to be there for those things, and it's really hard to do that in clinical dentistry. So in the end, as I was sort of building up my skincare business, I was able to drop back time in my clinical job, and that's meant that I can have more of a chance of being there for those things, because you can't buy time. You can't get that back, and if you miss those things, you're not going to get that opportunity again. So being able to be there and show up for just the small things, that means so much to them. It's the tiniest thing. It's playing the recorder for 2 minutes in the little show,
because
to them it's everything. When they see your little face, their little face lights up when they see you in the audience, and to be able to be there for that is so important.
And do you feel like if you had a career only in dentistry, it wouldn't really be possible?
I think it'd be really hard. I would have to take a massive cut in income, and because you'd have to reduce the days, unless you have a super flexible boss that will just let you change things at the drop of a hat. But realistically, we've got patients depending on us, and we don't want to let them down either. It's not just about how nice your boss is. It's we don't want to have to change things. We know our patients. We like our patients. They've planned their life around their appointments. So for us to be changing things at short notice, it's not great, is it?
Totally. And it is a business at the end of the day. You do have to kind of follow the normal rules. So before you have children, I'm sure it's totally different because you don't have those commitments. So you're there, the kind of 8 till 6, 9 to 5, no problem. But afterwards, you're right. It's nice to think about kind of other options, right?
Yeah, absolutely. So I joined the business in 4 years ago. When was that? 2021.
Okay, so it's how did you join it? Tell me more about that.
Yeah, so I actually started using some of the products because I was looking for some zero waste makeup.
Right.
And I think, again, after my daughter was born, I was looking just into things that are more sustainable generally. I've always tried to be as kind of eco as possible. But I think that shifted gear a lot more when I realised how many nappies and snack packets and things like that we were binning. And I think being at home on maternity leave, you're not there when you're at work. You're putting things in different bins. But when you're just in one place, you realise how much waste you create. So just to physically see that was quite powerful. So yeah, I was just trying to find ways to reduce waste in our lives in general. I found refillable makeup with Tropic and started wearing it, and then suddenly people started commenting on my skin, and that has never happened before in my life. So I started telling them about it, and I was really passionate about it. So a couple of people were like, oh, maybe you should think about doing this as well. So yeah, I decided to join the business and start doing that in an official way.
Amazing. Okay, so the point of this podcast is to actually let dentists or healthcare professionals know that there are kind of other avenues, other options. If you're, I guess, tired or, you know, want to do something different, it's out there. So you're a great example for that. So if I was listening to this podcast and I was like, wait, that sounds really cool that you've done that, what would be the kind of steps that you took to be a part of that business? You had to give me like, what, 3 steps?
Yeah, okay. So I think the first thing is contacting someone in there. So they contact myself and find out a little bit more about it. And we would do a little bit of training and things. But I think it's really just about talking to people about it. That's the main thing, is kind of getting it out there. And also, if you've got already people in front of you, if you're, you know, in aesthetics and things like that, you know, if you're not already talking to your patients about SPF and retinol and vitamin C, you know, like amazing skincare ingredients, I think you're doing yourself and the patients a bit of a disservice, because they're not going to get the best out of their skin. To me, it's a little bit like you know, doing a load of crowns and not talking about oral hygiene.
Yeah.
You know, it's like getting the basics and the foundation right. So yeah, I think it's really important to look at things as a whole, and really get a basis of healthy skin before we can then start doing the more bigger stuff.
Okay.
Yeah, I think having confidence and self-belief is really important. I think that's whatever people are thinking about doing. I think that's so important. And even if you don't believe it, just keep telling yourself, because eventually that will be ingrained in your subconscious, and that will drive you through. That'll kind of pick you up. That'll improve your resilience. So I think, yeah, just absolutely believing in it. And I think, again, whatever you're going to do, you have to have a purpose, have a bit of a why, because that's going to keep you going through the hard times. And be specific with it. Know what your goal is and why you want to achieve it. Because that's going to be a driving force. You wouldn't set off somewhere and not know where you're going, would you? You have to put a destination.
Set the location, yeah.
Exactly. And sometimes it isn't just about getting to the destination, isn't it? You know, the journey is really important, but you have to know where that destination is. And that might change. You might get to that destination and then pick the next
which is
point
totally
on the
fine.
route.
Yeah.
But you have to know where you want to go and why. I think that why is really, really key. So for me, that was about finding something for myself that was also going to create balance for my family, and something that was sustainable, that I could talk to people about passionately and know that it was going to be good for them and good for the planet as well.
Okay, so when you reached out to the company, what was the process of you kind of getting involved? Did it take a while? How did it work?
No, you can do it straight away. So it connected to me to like a local leader, and then she helped me get started, basically.
Okay.
And that can look very different for different people. So it really depends as to what kind of person it is, how they want to take it forward. It's ultimately flexible.
Yeah.
So people can sort of do it in whatever way they like.
Yeah, because you're based, like you said, in community, right? So it doesn't really match.
No, it's something that's quite separate to my job. You know, a lot of my colleagues do now use the products because I do talk to them about it, but not obviously during my work
and you're not
time.
recommending it to patients and stuff. For example, like if you were in aesthetics, you would do that.
Exactly. Yeah. So there'll be some people, you know, if there's dentists out there that think this sounds like a great idea, you know, it would be perfect for them if they've got a private clinical role that it can fit into. Absolutely. But anyone could fit it alongside for their friends and family, and their friends and family will have people that they know that they would want to share it with as well. So it can kind of snowball from there quite easily. I think a lot of my customers I didn't know before, and a lot of my team I didn't know before either. So I've met a lot of people along the way that think, this is amazing, I want a little piece of this magic. And they've then joined me, and I've helped to train them and sort of pass the torch effectively. So I think it's amazing for empowerment for people, because they've been able to create something as well, and that's really lovely for me to do that. And that's not something that I envisaged. I started it just to do a little bit of something for myself, and now I get so much back from helping my team to succeed as well, which is amazing. So it's transforming people in terms of their skin confidence from like a customer level, but then also really helping people to transform themselves and grow in confidence through my team as well, which is really nice.
Okay, so how was the progression in when you started? So were you kind of just recommending products to friends and family, and then what happened next?
Basically, that's how it started, to be honest. A few of my friends and family weren't bothered at all, and that was fine. Like,
most of the time when you start something
no
new, no one cares.
That's fine. But really, you just need one person, and then then they've got a friend, and and it snowballs from there. And I think when people start using something that they love, they just tell their friends about it. So it's nice, isn't it? And I think people really do want personal recommendation these days. There's so much where it's, just adverts and people
honestly,
paid to say things, and you just don't know what's true anymore. And especially now with AI coming into that as well, it's just really hard to know what is genuine and what isn't. So to know that you've got a friend that you trust who likes something, that's the best recommendation you can have, isn't it?
For
and
sure.
People definitely are wanting that personal touch. So I think that's really where this can be quite magical.
Okay. So in terms of what you do currently, walk me through your week.
Okay, doke. So Mondays is a dentistry day. So that would involve some routine patient clinics, some sedation, and then on a Tuesday I have my little boy. So that's more of a fun mum day.
Nice.
So yeah, I can do that now. So that's great. So that can be a bit of a day off, and fun with my son. So we go swimming, and we generally get a few little errands done, go to the park and things, just nice mum and kid things. And then Wednesdays is clinical day again. So again, usually some more sedation. I do quite a bit of IV sedation. And probably some routine stuff again. And Thursdays I do general anesthetic lists, and some inhalation sedation maybe. Just a bit of a mixture. Children and adults, mixture of sort of different special care needs, and then sort of squidged in there on an evening I might send out some customer follow-up messages. I might pop to see somebody who wants to try something, give them a little bit of a one-to-one consultation, or they might have a couple of friends that they we just drop off some products for them to try and things. And then on what day are we on? Friday is day off work now, so that's where I can really get my Tropic stuff done. I will probably meet a team member for coffee or something, help them out, see how they're doing, check in with them. Might go to the gym, go for a run. Little bike ride's been nice at the moment in the summer. Just whatever I need to do, basically. That's the ultimate in flexible working, isn't it? So I might have some little training meetings and things. I might meet some clients and things to talk about their skin, things like that. So just a total mixture, really, but flexible.
Sounds nice and balanced. Really nice. Okay, so there's two things I'm interested in. So firstly, your route into community dentistry. doing sedation, GA lists, things like that. I'm sure people listening would want to know more about that as well. And then we'll go back to Tropics as well.
Sure.
So tell me about your journey to actually becoming a community dentist and what led you there.
Yeah, so I did GPT, so I got to kind of rotate around the hospital department, so I could kind of try before you buy a little bit, which is good. To get different experience and different things. And I think I realised I liked most things. Really did like oral surgery. Liked peds as well. And just wanted a bit of a mixture, but I did not want to be sitting in the same room for the rest of my life.
Yeah. Fair.
So GDP land for me was just not what I wanted at all.
And you knew that quite early on, would you
say? I did, because I just like to be out and about. I really loved being in the hospital and, you know, popping around to different departments and being in like a bigger setting.
Yeah, it makes you feel part of a team, and you're not on your own.
I love that teamwork element, and absolutely, as a GDP, you know, you've got really good teamwork, but it's quite a small team, isn't it?
Sure.
A lot of the time, and I wanted that kind of bigger team thing going on. I did Max Fax after that, just really to tick the box, if I'm honest, because at that point, that was before DCT and everything like that, and you had to kind of do a Max Fax on call job to kind of tick a box to sort of progress to do much else. So I really just went there to tick the box and thought it was fantastic.
Yeah, that's lovely.
Really loved it. And then a job came up that was shared between Max Fax and community, which was quite unique at the time. It was to kind of bridge the gap between the two services for the head and neck cancer patients, because they were coming in and needing dental care before they could have their radiotherapy, but there was no one to kind of treat them.
Yeah.
So I came in, sort of bridge that gap between the two, and did that for a while. There were mixed jobs at the time, which were like a foundation training year, which was Max Fax and community. But because I'd already done GPT, I couldn't do that. They said I was overqualified, even though I'd actually done neither of those things. But it's because I'd kind of done my 2 years.
Yeah.
So I was like, well, I'll sort of create my own by doing this shared job.
In the equivalent of now, would it be like you did your VT, right? Then
yes,
DCT.
That was like mixed in with the hospital jobs. I did like a week in practice and a week in the hospital.
Okay.
It was like every other week, so it was 2 years. Like
is that common? Oh yes, it is.
Yeah, I think there's some. Yeah, I think there's some stuff like that.
Yeah. Okay, fine. And then after that, you did your Max Fax.
Yeah.
With the community?
No, so that was just Max Fax.
Yeah.
And then I ended up getting a job just community, and then the kind of double job came up.
Fine.
So then I was like, well, I've done both. I'll carry on doing both.
And do you feel like because you did whatever you did the previous year, it kind of qualified you to apply for the next thing? Or if someone was wanting to do that?
I think I was a little bit cheeky, to be honest, because I sort of said to them, I was like, I don't think I've really got enough experience to be a staff grade in Max Fax. And they were like, it's fine, you'll be fine.
Oh, good. You just have to ask.
Yeah. Okay. Yeah. So he was like, the consultant interviewing me was like, it'll be absolutely fine. We'll look after you. I was like, okay.
Oh, that's good. Lucky.
Yeah. So I did that, and actually it was fine, and it was really good. And obviously I just started with the more basic stuff, and worked my way up to the slightly more exciting stuff. But obviously there's only so far you can go with that without being dual qualified to actually progress in a proper Max Fax long-term route.
Yeah.
And I just didn't fancy that. And the idea of going back to do potentially 5 more years at uni, I just didn't fancy that. So
it's nice on paper.
Actually
being there.
And then I think long term, it being an on-call job as well, and knowing that I wanted a family, I just didn't really feel like that was the work-life balance that I was after. Yeah. As much as I probably would have enjoyed the job. I think you've got to think about the bigger picture.
Definitely.
As well.
Yeah. Okay, so after Max Fax community bridge, what was after that?
So that's when I sort of sat there for 5 years, really enjoying the job, because I was doing the staff grade Max Fax work. I was doing the senior dental stuff in community.
Nice, so you got really good experience.
Yeah, I did. Really good. I had a really supportive clinical lead in community as well, who I absolutely love. She's just retired. And yes, that was really lovely to be really well supported like that. So that was brilliant. So I just did that for a while, and I kind of progressed through training through experience through that, and got a lot of special care experience in that job. And as I said, I did diplomas in various things, and
Like what?
so I did special care dentistry diploma and sedation diploma.
Did you need to do that, or was that just because
No,
you
I
wanted
just
to?
did it because I wanted to. Yeah. I like achieving things. I like having
Yeah,
a goal to work
sounds
towards.
like it, for
Yeah.
sure.
So enjoyed doing that, and obviously was successful in that, so that was great.
Yeah.
And yeah, so I've just then got to the point where I needed something else.
Yeah.
Yeah.
Okay, so tell me about the diplomas, because again, anyone listening wants to do a diploma like that. Where'd you apply?
So special care diploma was through the Royal Colleges. So I did the Edinburgh one. You have to have a certain amount of experience. I'd have to look how much exactly you need, but I think it's about 3 years experience.
Okay.
To apply, and then you have to go and sit some exams. Basically, is the one that I did. I think there are some where there's some other assessment and things involved. But yeah, I did that, so it was really hard.
Okay, was it?
But yeah, I did it, and it was great. Came out with really good score, so that was brilliant. And had that experience kind of through the pandemic as well, which is a bit strange.
Really?
Like being like they're masks on, the examiners are just these scary eyes.
Oh my gosh.
But yeah, that was a good experience to do. And just made me realise, actually, like, you know more than you think you do. Just because you haven't got the consultant badge and things doesn't mean that you're not really capable, you're not really experienced. And I think there's no substitute for experience. I think sometimes people, coming in who are quite junior, they want to know what to do to get the thing, and you just think, well, actually, you've got to live a bit, you've got to have life experience, and you've got to just work and gain that experience. You can't read a lot of these things in the textbook, and having a badge doesn't necessarily mean that you've got it,
Which brings me on to a question of, you kind of did the diploma after all that experience, and you said you need 3 years experience anyway, roughly.
Yeah.
Is that as a GDP or in
So for special care, it's within special care dentistry in
Yeah.
some form.
Yeah.
So I suppose doing a hospital job that encompasses that, or working in community, are like generally the ways that you would get that. There are obviously some like tier 2 providers and things like that that would have that experience, but again, to get to that, they would have had to have prior experience.
So they want you to have that kind of lived experience before you just start a diploma, because I feel like nowadays there's just loads of diplomas out there, and people can just start them when you've had no experience in the field itself. So they probably should all have some sort of requirement where...
Yeah, I think some of them have a lot more teaching within them, I think. And perhaps people do like sort of the certificates and things first. Whereas this one was kind of lived experience, and then you do some written exams and some
Fine.
Viva type.
Yeah. And what was your second diploma?
So sedation. So did that through Newcastle University, which was great. There was a lot of teaching in that one, so there was quite a lot of study days to go to, and assessments through essays and things. There was a dissertation to do, and then some practical exams. You had to do a certain number of cases and things as well. So that was that was quite a different experience, actually, that one. But yeah, both great to do.
You would recommend, if it's somebody, again, like looking for not to be a GDP or maybe be in that one room for the rest of their career, they want to try something different, then this is a path that's quite interesting, I would say.
Yeah, absolutely. Yeah, I think community dentistry definitely has that and ticks the box for people. And I think a lot of people don't really think about it because they perhaps just don't really know about it. It's not really something that comes into dental schools, is it? I think, some hospitals will have a sort of special care dentistry department, but actually out in community, that's sort of, seeing a lot more of these patients kind of around where they live. A lot of these patients can't travel very well, so actually getting them to go to the dental hospital is quite a stretch for them, whereas if you can be in local community clinics, you're going to see like a real mix and get a lot of experience there.
Yeah, where I'm just trying to go back to uni and think about the exposure we got to community, and it was like a tick box thing, like you have to go and see it, but it wasn't something that we were like told that, you know, this is a good career option that you could consider. I don't know if you felt the same.
Yeah, so we had an outreach clinic, but it was kind of access patients. There was a few patients who needed interpreters, but there wasn't really the kind of significant special needs patients that we see that I would class as, you know, like real community dentistry. So I didn't really have much exposure to that at all. Yeah.
So you kind of had to make your own path, I guess.
Yeah, absolutely. But you know, you can start doing that at a community dental officer job. That's sort of the entry level, what we call like a band A community dental officer. And I think generally there are posts like that around. So if people were wanting to get into that, then I think contacting the local service is a great idea, just to show that you're keen. Maybe arrange some shadowing. Usually they're really happy to kind of let people come and see what it's about, because often kind of recruiting into community isn't the easiest, because people just don't really know that it's there a lot of the time. So they're usually quite keen to help.
Okay.
Yeah.
That's really good to know, actually. So anyone listening out there who's thinking of trying something different, I guess reach out to your local community, what's it called?
Community dental service.
Yes, community dental service. See, I know nothing. But yeah, reach out to them, and I think that would be a good start, wouldn't it?
Yeah, absolutely.
Okay, and was there anybody that you knew who was doing it, or literally, again, like you just had to figure out for yourself?
Yes, I met a few people through the like the outreach program, but I think I just sort of inquired, to be honest.
Yeah.
It feels like a long time ago. You think, how did I manage to do that? I think I just got in touch.
Okay.
Yeah, I think just reach out to people and have a chat with people, see what it's about, really.
Like you said, they're happy to help. They probably need the help in anyway. So yeah, I think that's a good way to start. So I would say, from what I've taken away in terms of that career path, is like you said, just research and ask questions. You don't have to go down this, you know, the route that everyone's going down, which is just general dentistry. There's so many arms to dentistry, and like you said, we don't really think about them. And this is a really important one as well.
Yeah, absolutely. I think if you like treating children, you like treating anxious people, you like treating people that are a little bit more complex, either kind of medically or physically, it's so rewarding. Because I love surprising people. So I love surprising parents, particularly, that they think their kid can't do something, and then you prove them wrong.
Love that. And you get,
and the same with a lot of this you know, special care adults. You know, their kind of carers and things think, oh, I'm not sure they're going to manage that, and then we're like, okay, well let's have a go. We're not going to lose anything. We might prevent them from needing to have a general anesthetic. Let's give something small a try and build things up. So helping people to kind of grow in their experience of dentistry as well is really nice.
That is really nice. And do you feel like you just get those skills, like you get taught those skills, or you get those skills as you work? How does it work?
Yeah, I think a little bit of both. I think you have to want to give it that time. I think you have to be a quite patient person. And not be too much of a perfectionist, because realistically you're not going to do your fancy
you just do your best.
Yeah, you do. And you have to accept that something functional is okay sometimes. Maybe it's not going to be the prettiest version of whatever it is you're doing, but it's going to work for them, and that's what they need. You know, they're not having pain, they're not having infection, and that's amazing that they, you know, they can eat. That's great news. But still trying your best for them, because they're still entitled to the same level of care as everybody else. So it's sort of finding that balance.
So you said patience is one skill to have.
Yes.
Anyone who shouldn't be doing this career path?
It's hard.
I just be brutally honest.
Yeah, I just think if you like your fancy dentistry, you know, if you love spending your day doing molar endos and crown preps and veneers and tooth whitening and things, then like that's not not what we do at all.
Yeah.
You know, we do some of those things, but we do it on a very complicated person, and the more complicated the patient is in their health and what they can tolerate, the less complicated the dentistry has to be. It has to be quite realistic.
Yeah, fair enough.
So I think if you are someone who just likes everything to be perfect and just sewing out the textbook, that's just not where
Which
not what
I
we can
think
achieve
that's
sometimes.
nice to hear, because I think most dentists are kind of put in a box of being like a perfectionist, or you need to, like we said, follow that path and be in that room and do everything really nicely. But if that's not you as a person, people might really struggle to be in that box. So again, I think it's really nice to talk about it and let the other types of people know that there's other career paths for you that aren't just perfectionism isn't the main thing. It's more compassion and patience.
Absolutely. I think that's two perfect words that fit with community for sure.
Okay, when you got into Tropic, when did it get to a point where you felt like you could reduce your days as a dentist to focus more on this? Like, was your income becoming balanced? Like, how did it work?
It surprised me actually, in that it did snowball quite quickly, and I wasn't actually spending any of the money. I just had it in an account, and suddenly I was like, oh, okay, I'm going to pay for a family holiday now, and I just that was quite a big moment
with your savings from Tropic.
Okay. And so that was great, and then I think it particularly changed when I became a team leader, because that meant that I then needed to give it a little bit more time, because I had people to mentor, and also my income had increased quite significantly, and I really didn't go into it to make money. I think with anything, if you want to be happy and successful, you've got to follow the joy. You can't follow the money, because if the joy is there, the money will come, and people, I think, will want to work with you if you're like happy and joyful and content in doing what you do, isn't it? People aren't going to be kind of attracted to working with somebody who's miserable all the time, are they? So I think it comes down to that kind of vibrational frequency thing, doesn't it? We want to have all the sort of the high vibe energy things. People are attracted to that, aren't they? So it seemed to it kind of took a turn. I realized that actually this hobby that I was really enjoying, that I was helping people with as well, was then providing an income, and it wasn't my initial intention, but it happened, and it was quite successful in doing that. A really good bonus. And then I thought, okay, well, actually now I can turn this into more of a job, and cut back on my dentistry. I probably could have done it a lot sooner, actually, but I think I was holding myself back a little bit, in that it seemed so different, and even though really it isn't that different. I'm still, the skin's our largest organ. I'm looking after health in that way instead, but actually it just wasn't what I trained for. That wasn't the path I was kind of meant to be on. I think if I got out of my own way a little bit quicker, I perhaps could be a little bit further forward even with it, and I think we do that. We hold ourselves back a little bit, don't we? That's sort of that's like an evolutionary safety thing,
for sure.
But actually, I do think get out of your own way is one of my favourite sayings. And I say that to people quite a lot. So if they're worried about something, I'm like, okay, just get out of your own way. Stop worrying about it. Like, it's the kind of, oh, what if I fall? It's like, well, what if you fly?
Yes,
you've
absolutely.
got to give yourself that opportunity and take that step. The magic doesn't happen in the comfort zone. You've got to get out of it a little bit, even if it's just a little toe, and then a foot, and then a little hop and a jump.
You don't have to, leap into it. Like you said, just little bits at a time. I was gonna say that's really brave of you, because I know it's like get out of your own way, but you did train in like a very specific thing. So I guess it is really different, isn't it? And I guess like maybe talking to colleagues or people that work with you, it's just not a thing that anyone else is doing. So you're kind of like, oh, I'm just going to do it and see what happens. But like the great thing with dentistry is you can kind of put your toe in, your foot in something else, and then come back Right.
Yeah, I think we're lucky in that way with dentistry as a profession. Like it's always there for you, and there's a lot of different forms it can take. So if you do want to have a little sidestep and do something different, then you can, absolutely.
Yeah.
And you can pick up your hours and drop your hours and things like that, can't you?
Exactly.
So I think at the end of the day, I was like, okay, if I drop some hours, this doesn't work out, I'll just pick the hours back up again. So there was a bit of a sort of safety net there, I suppose, but there doesn't have to be. And I think sometimes when there isn't a safety net, you're actually more likely to succeed because you're going to put more into it. Yeah.
Yeah.
Yeah, because
Okay.
you have to.
Yeah, you do.
Yeah.
But it is more scary.
Yeah, maybe.
Yeah, but no, I agree. But I think what I've grasped from like talking to those people on this podcast who have businesses or they've, cut down their week or doing something completely different now is we're very lucky that we do have that safety net of dentistry. Yeah. So just want everyone to remember who's listening, just count your blessings as well. Like you chose a nice career, even though it can be tiring sometimes or make you feel like you wish you did something else. It's a nice one to have, I would say.
Absolutely. Yeah. And I think being grateful generally in life is really, really important, and that will help overcome a lot of anxiety. So that's something that I've sort of learned on this journey. It's I've found a lot more sort of things that I thought were outside of science, but actually aren't, which I can probably come to in a minute. In that you can't feel grateful and anxious at the same time. So if you practice gratitude, that's going to really, really help banish anxiety. But also it then helps you just not sweat the small stuff. If you can just think about 3 or 5 things you're grateful for at the end of the day, then you're going to go to bed feeling good about your day, and that's going to make you want to get out of bed with positivity the next day, and that's going to make you have a better day the next day. If you start the day or end the day with a kind of a negative attitude, you're gonna take that into the whole day, and you're gonna see all the negative things, even when there's probably loads of positive things there. But you're gonna think, oh, I'm having a bad day. I've got bad luck. Oh, this has happened. Oh, it's because I'm having a bad day. And those things will pile up, and that kind of can take you in the wrong direction. Whereas if you focus on the positive things, that's just gonna keep lifting you up all
You're
day
so
as well.
right. You're so right.
Yeah.
And do you feel like that's something that you incorporate in your day?
Yeah, I really try to. Yeah. And I think there's always a lesson to be learned. And that's something that I really strive to sort of take forward, is that you never lose. You win or you learn.
That's
so
really
I don't think I
nice.
made that up. I'm sure somebody else said that.
No, that's
But
really
I think
nice.
it's really good because whatever happens, this is a learning opportunity. And if you can grab those wherever you can find them, then you're gonna progress in whatever it is
or
you're
turn
doing.
that negative experience into literally something you learned from and grow from that, right?
Yeah, and that's how you build resilience, isn't it? You it's not getting knocked down, it's how quick you get back up again. And if you have a bad situation, whatever it is, you can be sad about it, like that is okay. You can mope about it a bit, but don't unpack your bags there. Like have that feeling and then think, okay, let's flip this around. What can I take from this? What can I use as fuel to keep me going for the next thing? To maybe not make that mistake again, or just to move forward. There's always something to be learned, definitely. And I think that's a really good way to keep progressing in whatever it is.
I really agree, and I really like that outlook because I don't know, it's just a common thing. I don't know if it's our profession or if it's just like our life after COVID, but everyone's just kind of grumbly. And they just have like, that kind of outlook to life. But I think people are really trying as well at the same time to be positive. So I guess it's just like training yourself and, framing yourself in that mindset.
Yeah, exactly. Yeah, my mindset is absolutely everything.
Do you think like that's added to your success?
Definitely. Yeah, for sure. And I love looking at examples of this as well. So in sport and things as well, I think it's quite easy to look at these examples because they have a measured outcome. The person wins the race or the tournament or the title or whatever. But sports people are really, really good at being positive, visualizing themselves winning, and that doing that mindful work beforehand. And there's even been studies where they looked at groups who did the most physical training and like no mental training versus people who did kind of 50-50, and people who did way more mindful training and less physical training. And the success was in the ones that did the most work on their mind.
Really?
Yes.
Yeah, the mind is so powerful.
Yeah.
So tell me about, you're a team leader now?
Yeah.
So how did you get to that stage?
So I'm a senior leader. So I've had lots of people kind of join me on the journey, basically, and they then talk about Tropic to their friends and family, and colleagues, whoever, and it reaches out through their networks. And then I now have a leader within my team as well. So she then has her own team, which is amazing. So it's lovely, very empowering to help people kind of create their own little business within it as well, which is amazing. So some people literally just want to do it as a little bit of a hobby. Some people want to do it alongside their existing business. You know, we've got beauticians and dentists and nurses and people as well who do kind of do it alongside their role that it fits quite nicely with.
Yeah.
And then other people really want a whole new career as well.
So you can do that too.
Yeah, absolutely. So that's the beauty of it. Just ultimate flexibility. You can take as little or as much as you want from it, really, and do as much as you want, with whatever time you have, or whatever kind of passion you have. It depends what your goal is, really. And that may change along the way as well, like it has for me. So
okay, so when you first got into it, you kind of got into it with a mindset of you just want to try something a bit different. You built up a kind of like a clientele, and it just grew from there. Is it as simple as that?
Yes and no. So yes, in that it does grow because people love it, and they, you know, once they've tried a product, they generally will keep buying it, and then they'll think, okay, well, maybe I'll try some makeup or some body care or a deodorant or whatever. So they then expand their reach within the range, and then they will tell their friends about it because they'll literally see it on their face, you know. So there's that side of things, but also it's encouraged me to kind of go out and meet new people. So I might do little events and things where I go and do like sort of wellness workshops in workplace and things. So I've been to hospital wards to give a little bit of TLC to the staff there, things like that, to as a way of meeting new people as well. And I think it's just that kind of karma comes back around, you know. I don't kind of charge anything for that. I go and do that and start conversations with people. And they find that they really like it, they're interested. We have an amazing infinite purpose with Tropic, which is creating a healthier, greener, more empowered world. And I think people really, really love that, and so they should, because it's amazing. But it's all about the healthier side is all about clean skincare. You know, what we put on our skin gets absorbed into our bodies, and the penny really dropped for me with that when I was thinking about dentistry. You know, we put topical local anesthetic onto people. You know, people wear HRT patches, pain relief patches, nicotine patches, whatever. It goes through the skin, and we expect it to have a systemic effect. So why would we not think that putting skincare and makeup onto our skin wouldn't also do that?
Very true.
So when you think about what ingredients are in your skincare, that's when it's a bit of a Pandora's box, in that all that stuff's going into you. If you put something on your skin, it will get into your bloodstream faster than if you ingest it, which is just mind-blowing, really.
Yeah, I never thought about that.
Yeah, the majority of people have no idea what is in the products that they're using. And if they're, you know, on a supermarket shelf, if they're getting them in that way, generally they've got kind of toxins and endocrine disruptors and things in them in the form of preservatives. And there's so much evidence out there now about things like parabens, phthalates, even talc. You know, there's links to asbestosis and things from from talc, and that's in most powder, makeup, things like that. So there's just so much out there that we have no idea about. So once I've started realizing and researching into that, it was really important that I actually sort of shared that message to my friends and family. I didn't want them using products that are going to be damaging and dangerous.
I'm definitely going to be thinking about that now.
Yes, there's some good apps actually. There's Think Dirty is a really good app you can get, and Yucca, and that will tell you what ingredients are in your products and if there's any potential health issues there. So for me, it was quite an important role to educate people about what they're using and what the potential impact is. And then we have our sort of greener side, which is how I found it, the sustainability side. So everything's freshly made, everything's vegan and cruelty free. And we don't use any fossil fuel derivatives, which are in most kind of moisturizer type products and things. So we're really trying to make sure that we're doing things in a green way as well. And then the empowerment side is partly about people like myself, just being empowered to go and do something different, empowering people to make sort of healthy choices and things as well. But also we support a lot of charities, which was another thing I was looking for in a hobby, in that I used to do a lot of charity work before I had kids. I've been and volunteered with Bridge to Aid a couple of times, things like that. And I just couldn't really fit it in with work and kids, having like a regular commitment. So in doing what I do with Tropic, we do a lot of fundraising. 10% goes to our charities. So we have our own schools, and we support the Trussell Trust, Forestry England.
That's really nice to learn, and I think it gives you a good purpose, not just as a side hustle or an income.
Yeah.
There's more to it than that.
Yeah, and so seeing the videos of like the children that we support now is incredible to know that they before wouldn't have had any education. The girls are often getting married off at like 11, 12. And they're having children straight away. So if they're in education, that just gives them different choices, and gets these communities able to have new skills, get them out of poverty. A lot of the time they're relying on fishing and farming, which with climate change and pollution is getting so much harder. So that poverty cycle is just getting worse and worse. So they need to be upskilled. So education is just key. Education is power. If you can get education and get some different skills, then these communities are hopefully going to thrive.
That is super interesting. Yeah, definitely. I'm going to look into that more.
Yeah, so it's a charity called United World Schools that we support, which is amazing.
Okay, perfect. And we'll try to put some information about it in the description as well, so awesome. You guys can find out more about that as well. In terms of monetizing, so again, if somebody is listening and it's something that they might want to get into, they don't have to quit their job or even go part-time. It's something you can kind of do a few hours a week, would you say?
Yeah, absolutely. Yeah, that's probably the majority of ambassadors are just a few hours a week.
Yeah,
if that, they're just doing it a little bit, getting products for themselves, getting some products on their their sister and their mum, a couple of their friends, and then if they want to, they can expand it.
Okay, fine. So as somebody who has worked with different skincare brands before myself, how it usually works is just very transparent. You kind of buy the product, like you order the product, and you kind of sell it onto the patient or the client, and you kind of make some money off selling it to them.
Yep.
Is that the same way that it works?
So we have our initial kit that we use as samples. It's £198 to get that kit, which is usually around £600 worth of products, and then you don't have to hold any stock. So that's what's really important, because it's freshly made, and we also don't want people out of pocket. You don't have to buy any stock to sell to people. You would just order it direct to the customer.
Fine. So it goes directly to the customer as well. Okay, fine. So that's good. So they get to try the sample if they like. So is that what you said, you go to hospitals and
absolutely. So I got my little kit of things,
and
then I try them out with people, and can tailor little routines for them as well,
and they will place their order depending on what they like.
Yeah, absolutely.
Pretty simple.
Yeah, I know. It's I know it sounds too good to be true.
I think that that's another thing that some, again, like working with some brands, I feel like there's a pressure to like buy stock and hold it, and it's like that pressure of then selling it, and it gets really stressful actually. So I think it's nice where you've probably like thought about that and incorporated that into you know, it's not easy, especially if you're really just starting out. You don't want to be, you know, spending thousands on stock that you can't move.
No, definitely not. So no, we don't hold any stock at all. So just means it comes fresh to the customer, because like your fresh fruit and veg, you don't want that one that's been sitting around in the shop for ages.
No, I really
you
like
want it
that.
fresh from the tree, right?
Yeah, exactly. And I really like that. I've spoken to you about this because I wasn't aware, and to be fair, I've never really thought about what's in my skincare and what's in things that I use.
Now you're going to go and get those apps on the go.
I use it, but just for what I eat. And to be fair, I haven't been using it recently. But yeah, it's, do you know, because the first thing that I thought of when you were saying all the stuff, I was like, it's really great, but then it's like more work for me to do, where I have to go and research the ingredients, and it's just going to be so hard. But actually, it's as easy as just scanning it.
Yeah, you can just scan it on the app.
Yeah. So it's actually not that hard.
Yeah, it will tell you. I think Dirty has a bit more depth of information and things available, and that's kind of been around for longer and is more reliable, I think. But yeah, they're both great, to be
fair. Yeah, I'm definitely going to be using them. I'm going to be like scanning all the things that I use.
You'll be really surprised, actually.
I will be really sad.
I was really shocked with some of the stuff that was in, even like kid friendly.
Yeah, I was just going to say that.
Really quite shocking.
Yeah, it is shocking, because how is it on the shelves?
Because it's not regulated in the same way as food or medicines. That's why.
And I guess people don't think that putting it on your skin is going to do anything. Do you think?
No, I think people genuinely do think our skin is this sort of cling film barrier around our bodies to hold our organs in. Yeah. And it kind of is in some ways. It's kind of a bit waterproof. It stops us swelling up in the rain, but it's permeable. You know, things go through there, and skincare ingredients will go through there as well. And we can use that in a positive way, in that, you know, we can use hyaluronic acid to pull water into our skin when we want to hydrate our skin. We can put vitamins on there, and that's gonna give a nutrient enrichment to the skin where we need it. You know, we can use that to build collagen, to improve elasticity, do lots of different things, treat rosacea and acne and whatever. But it can work in a really negative way as well. If we're not using the right things that are clean and safe. And I think there's so much out there as well that people are just using the wrong things for their skin as well. And I think that's where having somebody who can kind of tell you the right things is really useful as well, rather than sort of feeling really overwhelmed in the shop or scrolling through all the options online. You can have a little bit of expert advice, effectively, from someone who knows.
Amazing. So anyone that's listening who may be interested in reaching out, what do? So they reach out to you, they purchase they'll chat to you and stuff, but then they'll purchase a kind of sample kit. Yeah. And then they'll take it to their friends and family. They'll probably learn in that process as well, like what's good to use for certain things.
And they'll probably have things that they like, which they'll talk about more. And I think sometimes people worry, I don't know everything about everything, and nobody knows everything about everything. You know, we have loads of support and training and things that's there. So I would be their mentor and kind of look after them through that process. We have an amazing online training platform. We have basically like a book which has a page for each product, which tells you exactly what it's for, what ingredients are in there, how to use it and stuff as well. And I do refer to that. It has all of our clinical data in as well, so you can't expect to remember all these numbers. There's a couple of products where I know the numbers because the numbers are really good and I like numbers, but lots of the girls in my team would just refer to that book. If someone wants to know how many % less wrinkles that's going to give them or whatever, they can look it up.
Cool. So you've got like a bit of a guide for people.
Absolutely.
Great. And do people set their own prices? Because again, with having experience in facial aesthetics and using skincare, selling it to patients, they kind of tell us to just set our own prices. How does it work with Tropic?
Yeah, so we have Tropic set the prices. There are kind of different bundles and things that go together to, if you get this with this, you get those buy one get one free, or you get this free thing with it and things like that. And I think that helps make it really easy for people. They don't have to stress about that. I feel like I'd find that really difficult. And I think people would potentially set the bar too low. because they'd be worried that people wouldn't want it, and
potentially. And then you're making pennies.
Yeah, exactly. You want to make a little bit of money, right?
Yeah.
So so it means that we always get a minimum level of commission,
Cool.
So
okay.
So that's good, and it means that people aren't undercutting each other and things like that as well. So it's all kind of
it's
a level
kind of
playing field,
yes.
And that's consistent and transparent for the customers as well.
Okay.
Which is good.
Yeah. Perfect. All right. Yeah. No, that's really good to know because, I think dentists that are listening who may be considering trying something different out, this is kind of an easy way to do it because you see patients all day, every day.
Exactly. I think you've got you've got an audience right there, haven't you? And it's just a way to add an extra income stream to your business for sure.
Yeah. If you do it well, it can definitely work really well. But when did it get to a level where you were making enough income from Tropic that you could drop down your days? And you said that it happened a bit later than it could have.
Yeah.
So were you working full time before that?
Yes, I think I went back 4 days after my daughter, actually.
Okay.
And then I dropped another day. I could drop more with my income, but I can't really do my job in less than 3 days, I feel, because I do too many things. I can't do all of my sedation and GA and all my routine patients and things in less than that. So at the moment, I'm kind of need to stick with the 3 days to feel like I'm doing my job properly.
Okay. So do you feel like the 3 days and then the 1 day, do you feel, well, you kind of said 1 day because the Tuesday you're with your boy, right?
Yeah.
So do you feel like the 1 day is enough to manage Tropic, or do you feel like you're juggling a lot?
It probably isn't, but because you can do as much or as little of it as you want, I can make it work. But if I had more time, then I would absolutely give it to Tropic because it's so rewarding in so many ways, and I just love it.
Okay, great.
So I think when you love doing something, you just want to do it all the time, don't you? So I find myself squidging it in wherever I can, really, which is why it's great, because I can do it like that.
Yeah.
But come September, my little boy's going to be going to a different nursery, which is kind of the school nursery, where it's like all the mornings. So he'll be there on like a Tuesday morning as well.
So you'll have that morning.
Yeah. So I can hopefully I'm sure I will fill the time, no problem.
Yeah. Cool. All right. So how do you prevent, because you're a mum, that's a big one. It's a big job in itself.
Yeah, it's a full-time job.
Yeah,
I
know like people put like dentistry or whatever first. Mum is a big one. I would put that first. Then obviously dentistry, and then you've got your Tropic as well. So how do you prevent getting burnt out? So we talked a little bit about having gratitude and being positive. Mindset's a big one.
Yeah.
Any other ways?
So I think trying to incorporate some kind of mindfulness and yoga and things, I really enjoy that. I don't do it as much as I should. I definitely need to do it more because I really feel the benefit when I do it.
Yeah.
But I think you do end up putting it last sometimes, and we do have to remember to prioritize that. So I've been trying to do a bit more of that, just like basic little meditations, even if it's like a 5-minute, 10-minute. It's amazing the clarity that you feel after just switching your brain off for those few minutes, and then having done that, the ideas will just start like pinging around, and there'll be new things that just come, which is great. I think something like that, finding some stillness in whatever form that is. I love being outside as well, and just being around in nature, just going for a little walk, or a little run, a little bike ride, whatever, just in some trees, or I live by the coast, so I'm really lucky that I can have a little pop out along the coast and things, just appreciating what is there in nature is amazing, because I think in our very sort of clean clinical environments and things, it's the opposite of nature.
It's anti-human.
Really. Yeah. So I think just getting out, getting fresh air, and just doing whatever it is that you enjoy doing. So for me, that is doing fun things with my kids. Yes, that is my mum job, but even if it's like going to the cinema where you get to sit down and be with the kids.
Life hack.
Yeah, just finding the things that you like doing with them as well.
Yeah, totally agree. Yeah, so I think, again, asked everyone on this podcast, like, what's your biggest thing? Everyone has said mindfulness. It's so important. I think it's one of the biggest things that I think it's just modern society. We just neglect our minds because we're just always on the go. We're always doing stuff. Nature, mindfulness, I think is just so important.
Yeah.
And like you said, even 10 minutes in a day, if we can incorporate that into our days, I think everything just feels better.
Definitely. And I think everyone thinks, oh, I haven't got time. But if you haven't got 10 minutes for yourself in an entire day, then we're doing something wrong.
And check your phone screen time.
Yes, absolutely. Everyone's got 10 minutes to doom scroll,
I'm
haven't they?
3 hours to do that.
Yeah.
But for some reason, I have no time to meditate.
Tonight, you'll be honest.
Yes, I will.
Yeah, I think just for me as well, having a skincare routine is really important as well.
Yeah.
Just having that few minutes for yourself as well. And then that's obviously got a benefit at the same time.
I do feel so good after.
Exactly.
Right?
And it's clinically proven people who have even a basic 3-step skincare routine sleep better as well.
Really?
Yeah. And then you look better because beauty sleep, they call it that for a reason. You need to repair. When you're asleep, your body's repairing and regenerating, and that applies to your skin as well. So that's why, if you've had a terrible night's sleep, people tell you look not good.
Yeah.
They're not being rude. It's genuine. Like, you don't, because your skin hasn't had time to look after itself overnight.
That's so true. I think I'm gonna definitely incorporate some of those things in, because
you'll be zen tonight now.
Yeah, for sure. First thing is downloading the app.
Yes.
Okay, so we've spoken about quite positively about the things that you do, but are there any cons of either of the things that you're juggling? Any downsides to what you do?
I think when something is flexible, you have the potential to do too much of it, maybe. I don't think I'm there, to be honest, because I do really enjoy it, and I feel like I'm striking quite a good balance, because it's all about time management, isn't it? So I try and manage my time, but I think there's a potential risk with anything, isn't it, that you put too much into things when you are passionate about something.
Yeah.
So I'm aware of that, but yeah, I don't think that's a problem. Hopefully.
No, not at the moment. So nothing else. Everything else is really great about what you do.
I think so, to be honest. I love having the flexibility. I think I would like there to be more days in the week, to be honest.
I love that. That's really nice.
Because then you could get more of what you enjoy doing done. I think just finding that flexible balance, is really, really
what
important.
about within dentistry? The dentistry that you practice, would you say there's any downsides?
So obviously I'm limited by what we can provide on the NHS, which sometimes can be frustrating, and waiting lists is a huge frustration. There just aren't enough of us. There's so many people with additional needs in various forms, and we just can't see people as quickly as we would like to. And I think a lot of these patients can't communicate, and we don't know if they're suffering pain and infection and things. The family and friends may not be aware. And it's only when we actually have a proper look in their mouth, we see that draining sinus that's maybe been there for a while, that it is sad that we can't get to them all, and look after them perhaps in the way that we would like to, because of the constraints of the waiting lists. If we had a magic wand, just bring everyone into community dentistry.
Yeah, I mean,
fix the NHS system.
Oh yeah, I mean that would be great. But I think it is maybe there needs to just be more awareness, because I'm sure that some dentists would like to follow that path, but maybe, like you said, people just don't know about it. So definitely, I guess, raising more awareness.
Yeah, absolutely.
Within the profession, right? Yeah. Okay. And let's talk about when you first qualified.
Yeah.
Because we know that dentists kind of struggle with battles, like when they qualify. Things that we've gotten so far is things like imposter syndrome, not knowing your path, what you want to do, or just feeling like you're not skilled enough. So did you go through any of those, or any other things that you could think of?
Yeah, I think for me, I was sort of led to believe that specialist training was the only route into something that wasn't being a GDP.
Right.
And I think that's because the people that teach you are generally specialists and consultants. I don't think they're kind of telling lies or anything, but that's what they've done.
Yeah. So they don't know any other way either.
And I think that there is a potential to then think that you're not good enough if you aren't doing that. And I think you don't have to go down that formalized specialist training route to do a really good job of doing what you're doing and have amazing experience. So I do think there's probably a lot of people out there thinking, do I go and do specialist training? Do I want to have to move and, go through that process, do national recruitment, things like that?
Yeah.
But actually, maybe not. Yeah, maybe you do. Maybe that is the path for you. But there are alternatives out there, and if you don't do that, it doesn't mean you're not good enough to do an amazing job at wherever you end up.
Okay, fine. And do you feel like that's how you found? When you qualified, that's the way that you thought it goes.
Yeah, so that's what I initially envisaged myself doing.
Yeah.
I went to Max Facts to kind of tick the box for that, and then I went to community to get some peds experience. Was actually kind of where I thought I was going. And then I kind of went there to do that, and then I was going to apply, and then I thought, do you know what? Like, I love this job. I love looking after the special care adults and the children, and I don't really want to have to turn my life upside down to go through that, and I actually looked at the community dental kind of progression, pay scale and all that, and thought, do you know what, actually the top of that is pretty good. So that means I can stay where I am, my family is here, and I can learn through experience instead, and then still obviously get some qualifications and things along the way if I want to. So it's just kind of forging an alternative path, and knowing that is still really valuable as well. So there's different routes out there, basically, is what it's all about.
Which is nice, again, to talk to people on this podcast about the different routes, because myself, I had no clue. So I think it's really nice for me to learn, and I'm hoping that anyone that's listening will learn a lot as well. And is there a message that you might have for a dentist that's kind of feeling stuck in their career? They might have listened to this and felt inspired, or feel like, I want to try something different as well. Any messages for them?
I think talk to someone about it. Definitely don't just sit and stew in your own feelings. I think that's really important in whatever the struggle ever is. Problem shared is a problem halved and all that, isn't it? And I think for protecting mental health, it's really important to talk to people, whether that's somebody totally impartial, whether that's your mum or your best friend or your kind of boss at work or whoever you trust, really. I think also people will have different opinions. You don't have to listen to everybody either. They will have appearance based on their based on their own experience, probably. So sometimes you need to speak to different people to get a wider view sometimes. And I think just take a step.
Yeah.
Be brave.
I liked what you said earlier about dipping your toe in something.
Yeah.
So if you're
you can
feeling
step back again, it's fine.
Yeah, just maybe take a break, or talk to someone, like we said, and dip your toe into something, see what you think. Listen to all the other episodes, because I've spoken to so many different dentists, and they have just educated me on so many arms to dentistry that I didn't even think about, or I didn't know much about. It's kind of like you hear that somebody's doing this, but you don't know anything else about it, or you send a referral to someone in community, but you have no clue how they got there. So yeah, I think it's nice to just educate yourself. Like, you don't have to go out of dentistry. You can just figure out what's for you even within dentistry. Last question for you is, if you had a dream job, which is just like in a parallel universe, you can do anything you'd like to do, what would it be?
Well, I used, they ask you this when you're like a kid. I always used to say astronaut.
Oh, nice.
I don't think I'd be a very good astronaut, but just being able to see the universe and see the world, see things from different perspectives.
Oh, so it's still astronaut?
Yeah, I guess so.
Oh, nice. Okay.
Yeah.
Why?
You just see all those amazing shots, and I think it just helps, like, seeing the bigger picture, isn't it? You can get really wound up in a really small problem, and taking a step back and looking at things from a different or wider perspective is so useful, isn't it? So I think that's like the big scale of that, isn't it?
I like that. Yeah. That's really nice and adventurous as well. And because you see that video of, when it's like, you think that everything's going wrong in your life, and then it zooms out Have you seen it?
Yeah.
It zooms out into the universe and the galaxies and whatever, and it's like we're literally like nothing in the universe. So if that makes you guys feel any better. So a message from me is that we are more than scrubs, and I just want everyone to remember that we are literally on this earth to do anything we want to do, and basically nothing is that serious when it comes to it in the end. There's lots of different paths like we've spoken about today in dentistry and outside of dentistry. And if you want to get in touch with Sarah about any of the Tropic stuff, then go for it. I think that's really nice to talk about. Any final messages from you?
No, I think just what I've said, really. Be brave, try things, don't get too stuck in your own feelings, and just go for it. Who knows what could happen.
Thank you so much for coming on today.
Oh, thank you for having me.